Cannabis, one of the more, or if not most, underestimated drug, in my opinion. In this video, I'm going to give some ways of thinking about a relationship with cannabis, which is a drug, substance, if you will, and why it is one of the more underestimated drugs when you look at it in a context of all the other drugs that are out there: alcohol, opioids, opiates, heroin, Oxycontin, hydrocodone, etc. You get the idea of opioids. What about stimulants, amphetamines, right? Methamphetamine and psychedelics. There's a lot of drugs. You get the idea of the different types of drugs when you look at all of them and their, effects and how they affect the person. Some of the times, how we internalize different types of drugs affects how we feel about it, right? Which influences behaviors, of course. Feelings influence behaviors. I listen to individuals sometimes and they'll tell me, well, I've been sober for 10 years, 10 years sobriety. And then they're kind of giving me an inventory of things they've used and maybe drugs they still use, right? So, and one of those things that they'll still use is cannabis, or maybe they still drink alcohol too. And I will kind of just, kind of put it back to them in the form of a question. What is their idea of sobriety? Because different people have different definitions or opinions, ideas of sobriety. My opinion of sobriety does not include if you're still using alcohol and cannabis as coping mechanisms that alter your mood, influence your behavior in an unhealthy way, has some sort of a psychoactive effect, if you will. So for me, that's not sobriety. But some people will see it that way because they're underestimating the implications of having a chronic dependency or habit with cannabis and marijuana. Now, I'm going to, premise and give some examples of my reasoning, if you will. So I'm a licensed professional counselor in the state of Texas. I have more than 25 years, plus 25 years, perhaps 26, in the mental health industry, working with individuals, both mental health, also addiction, chemical dependency, substance abuse issues, and different levels of care, intensive outpatient, IOP programs, outpatient as well, my own private practice. And over the years, I've made a lot of observations in terms of how people internalize, how they think about certain behaviors, including their relationship with drugs. And the thing is, cannabis, people will say, well, it's a plant. It's it grows from the earth. That makes it safe and okay, right? Or it's not like I'm shooting up with those heroin addicts do, right? I'm not shooting heroin into my veins. Or what about people who inject cocaine intravenously or methamphetamines? There are people who do that, right? I'm not those guys or girls. I don't do that. So people, will downplay cannabis, especially that it is being legalized in a lot of states and maybe pending being legal in others. And we already know that for most people to understand, it's not so much an issue of whether a drug is legal or not. I mean, look at alcohol. Alcohol is legal. Clearly, there's a lot of problems with alcohol and how that undermines people's health in different domains, whether it's relationships, your physical health, a career, a job, finances, mental health, etc. So there's a lot of ways. So there's a lot of ways that our health can be undermined in different domains of what comprises our health. So a couple of things here with what's part of my opinion for why people underestimate the harmful effects of cannabis. One issue is that I get a lot of people and how they justify using cannabis, or basically what is their rationalization, why they use it. So to distinguish between two things that are happening here with regards to people's justification, why they use cannabis. I get a lot of people that essentially they admit cannabis is a coping mechanism. They're basically, they're just indicating it that it's like their medication, right? I smoke weed, marijuana, I get high to help my anxiety, right? Well, anxiety is a part of life. We all have to find ways to manage it and cope with it. Some people may have other issues going on, perhaps underlying things, medically speaking, other contexts, or maybe perhaps with some people, they might have an anxiety disorder that can happen, or there's issues that fall under the umbrella of anxiety disorders. Some people, they might need some type of treatment because they have some significantly clinical symptoms within maybe a 12-month period. It's really affecting their life. Maybe they might need medication assistance treatment. Perhaps some individuals, a certain percent may need that, right? In that situation, it could happen. And even then, it would be the argument over what has the best benefits versus risk ratio, right? Using illicit drugs with no supervision, or maybe go speak to a doctor. But I will say this: a lot of people who make the argument, the reason they smoke cannabis and weed, or weed, right? Whatever name you want to call it, pot, marijuana. The reason they use it is, I do it for my anxiety. I got to smoke weed because that's how I manage my anxiety. I got to have it, right? I'm helpless without that weed. I got to do it for my anxiety. The truth is, with some individuals, the reasons that led to their relationship with using marijuana had nothing to do with anxiety. If you look at their baseline of what their mental health was and behaviors were like before cannabis, there's no anxiety problems going on there, or they have this issue. They may have started using marijuana for fun, right? Excitement, maybe love and belonging, peer pressure, hanging out with people. Other needs were being met, because that's really what drugs are used for, is fulfillment of needs. So these individuals start off using cannabis for those reasons. Later on, they'll say, well, I use it for my anxiety. Well, here's what's happening with a lot of these individuals. This is more of an issue of a progression that happens over time, with tolerance and withdrawal issues. Physical dependency, tolerance, physical dependency, withdrawal. So what happens is, I've had neighbors like this. I've known people in my personal life, chronic use of marijuana every day. It's daily usage of it. And they would wake and bake, to use that term, right? First thing they'd want to do when they wake up in the morning is smoke a bowl of weed, maybe a couple bowls, right? So these individuals were no fun to be around. If they'd went too long or an extended period of time without cannabis, because they would become very irritable, even anxious, and they would just get in this mental state. Their mood would be less stable. They're no fun to be around. They're very cranky and irritable. As soon as they got their fix and smoked a bowl of weed or rolled a joint, yeah, they feel a lot better. They're happy. They're calmer. So this makes sense from the perspective of tolerance, physical dependency, and withdrawal. So as similar with other drugs, whether it's people who are dope sick from an heroin addiction, that physical dependency, yeah, they don't feel good when they go into withdrawal. They haven't had their fix. So they might get bone aches, chills, diarrhea. It's unpleasant, right? And then their mood, right? More anxiety, irritability, very anxious. So when they use the drug again, it takes them out of withdrawal. They're no longer in withdrawal. So they feel quote unquote normal, quote unquote, right? The new normal is when I get my fix to take myself out of withdrawal. So then this becomes either confused as I have an anxiety disorder now, or basically they may understand it's a tolerance withdrawal issue going on, but they prefer to say it's my anxiety. That's why I need to smoke. That's not what's happening in these cases, if we're looking at it from this lens. And a lot of individuals, this is exactly what's happening. So in this situation, we need to be honest and differentiate between different issues. Tolerance, withdrawal, yeah, you're not going to feel good. If you go so long without smoking cannabis, weed, you're going to get irritable, anxious, and so on. When you smoke it again, yeah, you're going to feel better. You're not in withdrawal anymore. So that's a different issue. And a lot of individuals who make a decision to detox themselves off of cannabis and to become sober from it, abstinent from it, they do go through an adjustment period of more acute withdrawal symptoms, and then maybe more protracted or post-acute withdrawal stuff that goes on for a few months until they get a bit more homeostasis and balance back again. The brain, sleep, things becoming more regulated on their own without needing cannabis. And that's another thing about how cannabis is underestimated, is this sleep issue, right? Chronic use, daily use of cannabis, it will undermine your quality of sleep, the quality of that REM cycle sleep, rapid eye movement, the deeper stages of sleep. And you don't have to trust me. You can research this on your own. Plenty of videos on that. Dr. Huberman, his videos, he talks about cannabis. Yeah, it shortens your REM cycle sleep, or even can prevent you. It just undermines it. You're not going to get that deep quality of sleep. In fact, I've lost count of how many individuals have told me that they don't have dreams anymore. They don't dream because they smoke weed every night. They wake up, they feel unrested, irritable, and so their quality of sleep is not good. That one variable alone, by the way, as most people understand these days, can either undermine your health or support it, depending on what's going on for your quality of sleep. So in regards to this situation, holistically speaking, sleep is important. Cannabis undermines sleep. So just with this one variable alone, our sleep, that alone can either undermine our health and many of the domains of health, whether it's physical health, mental health, other issues, or it can support it, help it be optimal, and improve it. So smoking cannabis clearly is not going to help our sleep. So when we look at cannabis usage from a much bigger picture context, how it undermines sleep and also affects other areas of what constitute our health, it's clear that it is a serious drug. It can be very disruptive. What about emotional intelligence? Our utility, emotions have utility and purpose. They're necessary. And to the extent we have the ability to be emotionally available, this affects our relationships. It really does. So cannabis can undermine and affect our ability to be efficient with emotional availability, not just emotionally available to other people, but to ourselves, to be able to understand and process emotions, which influence behaviors, help to define relationships. When I am emotionally available to a person in a relationship, it reduces the uncertainty in the relationship. It helps to define it, make it more predictable, helps the other person feel more secure within the relationship and less anxious. That's a good thing. That's good for relationships and intimacy building, to build intimacy and trust with people that are important to you, like a spouse or family member, or maybe a best friend. So the thing is, with cannabis, it's not an accident, in my opinion, that we call it getting stoned, right? Or what about, I'm going to get faded, right? I used to know a guy, he was a waiter. So before he would go to work, he would say, I'm going to get faded. He'd smoke a couple of joints. And what he meant by that is because he didn't want to have to feel the stress and deal with his emotions because of the stress of dealing with customers in a busy restaurant, right? So he would get this blunted affect, right? So his ability to fully experience emotions was blunted. It's dulled, numb, if you will. So this also goes the other, goes in kind of both ways, right? Not just with my ability to be emotionally available to another person, and then to be able to be reasonably accurate, to share information with people, or even understand my emotions. But the situation on the other end of it, people on the receiving end of a relationship with you, if you're in this faded state of mind, or if your mood emotionally you feel faded, that blunted affect, people around you can feel a bit frustrated with that. You may appear to be checked out. You're not fully present. And people in a relationship with you, yeah, they might feel lonely. They don't feel seen, can feel a bit like they're not even with a person, right? You're physically there, but you're kind of checked out. So this is something with just our emotional regulation, our affect, being able to be emotionally present, understand our emotions, accurately share them, and have this intimacy and connection with people. If I'm stoned every day, by default, that's not going to help. That's not going to help. That's not going to help relationships, right? I know a lot of women who complain about their boyfriend or husband who's stoned every day. He's always checked out. I can't have a deep conversation with him. He's just really, he's not there, right? There's really no substance there in terms of any idea, expression, or exchange of emotions and feelings, right? So in this context, a lot of women feel lonely. They don't feel seen. Yeah, they end up maybe having affairs too, right? They meet a man who is able to fulfill their needs, right? He's a good listener. They feel seen. He hears them. He demonstrates he can understand them, right? So just a little side note, right? People don't just cheat for no reason. A lot of reasons people might be unfaithful in a relationship. Anyways, let's get back to topic. So here's another thing I want to point out as to why people underestimate cannabis, is because they have this habit of trying to make decisions on whether or not cannabis is the best, whether it's a good idea for them, right? If it's maybe a good decision, maybe is this the best thing to be doing, to be smoking that weed, right? they make the decision based on looking at exceptions of other people who are highly effective people in life with and the various domains of life. They're effective in relationships, business. They might even be in good physical shape. They're highly efficient, right? You get the idea. And yeah, they might actually do a pretty good job with communication with people. And so like, well, look at that person. Look at them. They're fine. They smoke weed, right? I mean, look at this guy. He smokes marijuana, right? He also has a #1 podcast. He has 2 black belts. One is in Taekwondo. Other black belt is in jiu-jitsu. A business person, actor, etc. And yeah, if you're guessing I'm talking about Joe Rogan, you're correct. I hear a lot of people tell me, well, Joe Rogan smokes weed, and look at him. Well, that's right. Joe Rogan smokes weed, and he's a very effective human being, clearly. But the problem with that is not everybody's Joe Rogan. And you may not necessarily be Joe Rogan either. Is it a good idea to make a good decision for yourself on other people's situation? Because that is not necessarily going to be representative of your situation. And I see this a lot. People focus on exceptions. Same thing with alcohol, right? Well, John Doe, look at him. He drinks, and look, he's got his shit together, right? He's doing good. Well, it depends on what measures you're looking at as to what your idea of having your shit together is too. But there's always a balance, and some people just may have better boundaries or rules and limits with how they use something like cannabis, even alcohol. So here's the deal. Here's how I like to think of it or speak about it. So let's say arbitrarily, I'm just going to pick some numbers for what is neurotypical, what are thresholds or baselines for people. So let's say the average person in the United States is a 1 to 10 person. So the average person in the United States, if we say they are a 1 to 10 person in terms of what is the upper limit of full potential of their abilities that they can access and bring into focus in a given moment to be intentional, effective, and apply themselves towards a task, a problem, a process, or situations. It's their upper capacity. It's kind of like, I don't know, if you have a 5-speed transmission, yeah, you might only need first gear for certain things, but you got that 5th gear, right? If you need to go faster. So we all have this kind of a 1 to 10, if we want to call it a 1 to 10. Let's say the mean average is 1 to 10, most people. So these 1 to 10 people depend on how much weed they smoke or maybe other drug, but we'll say cannabis because the video is about cannabis. Let's say it dials you down to a 6 for some people. Maybe you're being dialed down to maybe an 8 or 6, maybe a 5. So now your upper potential is not a 10 in those moments when you're stoned. It's maybe a 6. Well, so long as you only stay in situations where a 6 will be sufficient for you to be effective, you might be okay. But what if you have certain jobs, responsibilities? What if you just have different contexts where you need to be maybe closer to that 8, maybe sometimes up to that upper 10 for certain situations to remain effective across different domains and contexts throughout your life. So in this instances, even with the mean average, if you're a 1 to 10 person, cannabis in certain situations will undermine you because you're being a bit handicapped. You're not able to fully access what you need, cognitively speaking, your focus, your attention. You may even become apathetic. You're no longer being as intentional. So they call that amotivational syndrome. Amotivational syndrome for chronic use of marijuana. So this is the mean average. If we're just arbitrarily just coming up with a range or number, what if some people are unlucky, the unfortunate, right? Few. You're not even a 1 to 10. What if you're a 1 to 7, 1 to 8 person, but you live in a world that is built around being a 1 to 10 person? Well, you're already off kind of a bit disadvantaged, right? It's like, shit, this world's based on a certain mean of what you need to be as far as what's neurotypical to be reasonably efficient in life. And there are people who are like this. They might have learning disabilities, ADD, ADHD. ADD also has a higher stimulation threshold in another context where they need more stimulation to feel focused. So with a stimulation threshold, let's say people are 1 to 10, they might be 1 to 15. They need more to feel focused and to not get distracted. That's a whole other issue, ADHD. But just in the general sense of efficiency in a general broad sense, with the 1 to 10 example. So if there are people who are handicapped, they're not 1 to 10s or 1 to 7, maybe 1 to 8. Yeah, you don't have as much wiggle room to leverage, right? You smoke weed and get stoned. yeah, you're going to be dialed down to maybe that 5, and now you're really in trouble. You're going to be the 40-year-old guy that lives in mommy's basement of mommy's her house in the basement, still being stubborn, telling people that smoking weed's not, it's not bad for you. Look at me. Look how good I'm doing. So the thing is, there are people who are the lucky ones, right? Yeah. So if the mean is 1 to 10 for what's typical for how people operate, attenuating to things in life per context, right? What if some people are born freaking 1 to 15? You're born of 5 extra bonus points or hit points, right? If you play D&D, right? Yeah, you got 5 extra points there. So you're a freaking lucky person, right? Lucky ducky or lucky pucky, whatever. So when you smoke a joint and get stoned, it might dial you back 5 points to a 10. But even at a 10, that's still the upper limit of the average person. And 10 can still be pretty damn good for a world that's based on 10 being the best, right? Of what most people can attenuate to is with focus to deal with processes in life. So that 1 to 15 person gets away with it a lot better. You're not as undermined as much. Hell, even if it dialed you down to an 8, you're still probably okay. So your cushion, if you will, of how you're being dialed back when you do smoke, you still got enough left over that compared to the average person, you're still going to do pretty good. Still going to be doing pretty good. You can call it the more functional individuals. So yeah, maybe Joe Rogan does smoke weed, but he could be a 1 to 15 guy. When he smokes weed and gets stoned, he's only dialed back maybe to a 10. And hell, 10's pretty much pretty good anyways for the average person to still do what needs to be done in life, right? Be efficient, attenuate to things, attention to processes, have focus, and so on. On a side note, it's interesting that people who suffer from sleep deprivation with deep sleep, REM cycle sleep, they don't get that quality at night. They wake up, they feel irritable, anxious, unrested, but also they have symptoms similar that look like attention deficit disorder. They have problems with focusing, multitasking, more easily distracted, right? And with a lot of mental health issues, whether it's mood disorders, situations with dependency of drugs, when a person is able to resolve that and correct their sleep schedule and have healthy, deep quality sleep again, you'll see these issues be resolved. They don't have the symptoms anymore. Being distractible, attention problems, that goes away. And their mood regulation gets more manageable too. They can manage their anxiety a lot easier now. Because we need some degree of anxiety, by the way, for most people understand that. You don't want anxiety to go away. That's the opposite, that apathy, like that cannabis causes. So I think you're getting the idea of what I'm talking about is that this is an individual situation. We can't be making decisions based on other people because we're different. We're all different. It's just what it is. Life is not fair if you want to look at it that way, right? So do I make a decision based on because Joe Rogan smokes weed or some person I might know in my personal life who's highly effective smokes weed and maybe from your point of view appears to be successful? You know, you got to be honest with yourself. What's representative of you? So historically speaking, based on the evidence of your behavior across multiple contexts throughout the history of your life, how much evidence is there that you've ever been one to manage it, right? In other words, you're just going to be the person who smokes every once in a while, right? Yeah. And then it's really not much of an issue. The truth is, a lot of people, that's not the case. In fact, most people that have come to me with a problem because of their substance use disorders, addictions, and what have you, 99% of them, the historical evidence is that it's always a progressive situation. It always progresses with an issue of tolerance, withdrawal, using more of the drug, and then escalation and where it's undermining their life. So the truth is, for some people, it's just what it is. It's just the benefit of trying to use cannabis does not outweigh the risk to their health and just their efficiency in life. So if this idea of comparing yourself with other situations or using other exceptions as justifications to use cannabis, this will be seen sometimes too. People will point out exceptions for medical or medicinal use, such as a cancer patient or someone who has a wasting away type disease, like people with HIV, when they would have full-blown AIDS, they would have a wasting away situation, losing muscle, they lose their appetite. So in this situation, medical doctors determined that medicinal cannabis or Marinol would be prescribed to them within this context because the benefit outweighed the risk. These are people that, what good is it going to do them if they're dead, right? I mean, it's a good trade-off in that situation because cannabis will help increase the appetite. They start eating more, right? So the benefit outweighs the risk in that context because, yeah, this is life or death. These people could die. Makes sense. So when people use those as reasons to feel less anxious about their cannabis use, you just got to ask yourself, unless you have cancer, AIDS, or any other wasting away disease, or maybe people with glaucoma that use cannabis, unless that's your situation, that's not representative of you. So just to kind of summarize here, to kind of wrap this up a bit, is that, yeah, cannabis is being internalized in ways toward it's being an underestimated drug. One, because people confuse it for why they're using it. They'll basically say cannabis is their coping mechanism to manage their anxiety, when really that's not what's happening for a lot of people. It's more an issue of tolerance, dependence, and withdrawal issues going on. As I mentioned earlier, so there's that. That's not an underlying anxiety disorder. You don't have an anxiety disorder in that case. What you have is a dependency with a drug that has withdrawal symptoms, and you only use to try to feel normal again. And that's a whole other issue. So in this context, that's an addiction. You don't have primarily the problem is not an anxiety disorder. So there's that. A lot of people justify cannabis. Well, I use it for my anxiety. There's a lot better ways to cope with and manage different types of anxiety. And there are different types. That's a different video. Number two, comparing ourselves to other people who are highly effective human beings who might just have what's neurotypical for them may be much higher than an average person. So they can get away with more than we can, or the average person can. So it's what it is, right? Myself compared to other people, I probably may be at a much higher baseline with certain things in which you think that are neurotypical, and I may be able to get away with a lot of things they could not, right? And there's probably people that may be dialed up a bit higher than me. And so in that context, I couldn't compare myself to them just because they're doing something. They have that different ratio situation with what they can handle, how they're affected, than if I try to apply their behavior, their lifestyle, and then make it my own. It may not work for me the same way. So you get it. There's always somebody is bigger, better, and badder, as they say, right? Get the ego out of the way. Remove your ego, your pride. It's what it is. So there's that, comparing ourselves to other highly effective people who happen to smoke cannabis too, right? And then thirdly, other exceptions, the medicinal use excuse. Well, they use cannabis, doctors prescribe it. Yeah, they sure do. But there's a specific context: cancer, AIDS, perhaps glaucoma, I believe, right? Where you need to increase your appetite, other issues going on. Or just palliative care, right? People who are dying, they might let them smoke a little weed, right? Make them a little more comfortable towards the end while they're dying. So this is not a moral issue. To sum this up too, I want to throw this in here. It's not a moral issue. It's not about whether you're a good or a bad person. And quite honestly, my opinion in my personal life, what people do, it's really their business. Professionally, I try to help people to gain insight based on logic and honesty within a context of what's the best thing to do for their individual situation, and to the extent maybe help them work through any ambivalence they may have to make whatever decision they will make. And at the end of the day, it is a decision whether you continue smoking, take responsibility for what that's going to imply, where it will undermine you. It is what it is, a decision. Or maybe you want something different, and then you're going to try a different way of living life without cannabis. That's an individual situation. And in my personal life, whatever people decide, I'm not going to lose any sleep over that. Everybody does their own thing. And a professional relationship, yeah, it's different situation, different type of a ethical, different type of a supportive type of relationship where I'm trying to help people from a treatment standpoint. It's a different situation. So it's not a moral, whether your issue if you're good or bad. I'm just making this video to challenge you to critically think, what is the best thing for you? Maybe you've been underestimating how cannabis undermines your life. Maybe it's undermining your relationships. Maybe you have a girlfriend who feels frustrated with you. She wants you to stop smoking cannabis. And quite frankly, if she's the only reason you would stop, that's probably not going to last anyways. Because what if she left you anyways? Then what's your reason to really change the behavior? So if you want to change this, it would have to be for yourself. For those of y'all who might be in relationships where this is an issue, I see this happen a lot. Frustrated girlfriend, or what it happens the other way too. Frustrated boyfriends feeling frustrated with a girlfriend, or a person with a other relationship partner, if you will. Yeah, it happens. It happens. What about your physical health? The domain of sleep, right? What about exercising? Yeah. How's that supporting you feeling to be consistent? Your priorities, how you prioritize things. Does marijuana support or undermine that? The mental health, right? Mood regulation, emotional regulation. So how is marijuana, cannabis either undermining or supporting any domains in your life? I know one person, not kidding you, just the financial domain was enough for this individual to feel compelled to stop smoking cannabis. This person was spending easily $5,000 to $6,000 a year on cannabis. Yeah, $5,000 or $6,000 a year over the next 5 years. It's a lot. It's a lot of money, right? A lot of money. So the financial domain, that one person, that's enough. This is a problem, right? This is not sustainable. We all have different values. And ultimately, what's the most important thing in these different domains is whatever we make a priority, right? So maybe some people might not prioritize physical health, but they'll prioritize their financial situation. Damn it. I can't keep spending $5,000, $6,000 a year on weed or cannabis. So anyways, I could keep going all over the place with this. Cannabis, for some people, it's what it is. Maybe they smoke it sometimes. They're highly effective. And the same with other drugs. Some people might drink alcohol sometimes. It is a bit manageable for them. It never becomes unmanageable, if you will, where their life starts getting a bit out of control or affected. And some people, it's what it is. You're never going to be somebody who will manage it. You're always going to be inclined to just abuse it a bit or maybe too much, and then it will continue to progress. And maybe a bit of a back and forth, and then it progresses. And yeah, it undermines things. It affects your relationships, yourself. You're not the best of who you could be. So until I make another video, I hope everybody has a good weekend and take care. Thank you.